Charlie Nam welcomed many diverse professional challenges during the decade of the 1970s. After completing a term as chair of the FSU Sociology Department at the start of the decade, he brought the editorial office of Demography, the PAA's official journal, to FSU in the mid 70s and served a term as the editor of the journal. With other FSU colleagues, he helped to secure major grant funding from the National Institutes of Health and the Ford Foundation for the demography training program at the university. Along with all his other work, though, throughout this decade, Charlie retained his long term interest in comparing mortality patterns for different countries and social groups, as the topic grew in importance and scope among other demographic researchers. In 1972, three demographers at Berkeley, Sam Preston, Nathan Keyfitz, and Bob Schoen, published a massive collection of life tables for many different countries in book form, including mortality broken down by different causes of death. Charlie Nam seized on this milestone in data collection to revisit the topic he had examined in 1968, the puzzling mortality crossover observed between some population groups in old age.
The data came from mortality populations for national populations by Preston, Keyfitz, and Schoen, a large book, and that just was available to us, and they drew from that book as needed. And all of the variables that we needed in our study were in that source.
A half century ago, there were no convenient electronic databases filled with numbers ready for computer analysis of patterns in death rates, no spreadsheet software programs, no personal computers. To do original empirical research using information like that in the book by Preston, Keyfitz, and Schoen, somebody would have to enter all the needed data by hand, one number at a time, into an electronic format usable in computerized calculations. Such time consuming, mind numbing work often served as a ritual of passage for graduate students training for eventual careers in demography, and this project of Charlie's was no exception.
Well, Norman Weatherby and Kathleen Ockay were both students of mine in the late 1970s. They were here at the same time. Kathy had summer employment at the Census Bureau, and then after her graduate work was a demographic on a demographic team at the state of Florida, helping to develop the Florida populations. Norman was first employed after his doctorate at the Columbia University School of Public Health, and later became a faculty member at Middle Tennessee State University, where he has recently retired. Kathy Ockay, I'm not sure what she's doing now, but she's no longer with the state of Florida.
In his previous study a decade earlier, the anomaly of a mortality crossover appeared in comparisons of death rates by age for black and white populations in the United States. The new Preston, Keyfitz, and Schoen publication provided a different possibility. Instead of comparing subgroups within a single country, it would be possible to compare age curves of mortality between different countries. The published volume of life tables for national populations provided an enormous comparative perspective on the age patterns and risks of death. As noted in this 1978 article, Nam and his graduate students considered over 1,000 possible comparisons, including comparisons of pairs of countries with each other, and also, where data were available, data for single countries observed in different years. In most cases, these comparisons of age curves of mortality yielded simple results of higher death rates in one case than in the other across the whole age range, without any old age crossover. Even these cases seemed relevant to the issue, however, because they often showed a narrowing of the difference in compared death rates at the oldest ages, even if these age curves did not actually cross. For example, comparing Belgium to Sweden in 1964, Belgium, with a lower economic level of gross national product per capita, showed higher death rates than Sweden, its wealthier neighbor to the north. But the mortality gap between these countries pretty much disappears after age 80, and the age curves of death rates converge to very comparable levels.
The matching criteria we used were similarities in average life expectancy at birth, calendar year of mortality data, per capita income, regions of the world. That was done so when cause of death patterns were compared, the comparison would be a function of the different slopes of the curve of mortality and not of the variables used in the matching procedure. And I emphasize this notion of slopes because in some cases where there weren't crossovers, there was a narrowing of the slopes.
But in 279 comparisons, Nam and his students did observe the old age mortality crossover. Lower death rates at young ages in one of the compared countries or years crossed over in old age and became higher death rates than observed in the second case. In 168 of these comparisons, the country with lower mortality at younger ages and a crossover to higher old age mortality also exhibited a higher economic level as indicated by per capita GNP figures. For example, this crossover appeared for the comparison of 1964 life tables for Canada and Sweden. In Sweden, the country with higher GNP per capita, death rates were lower than in Canada at ages up to about 70. But after age 70, the mortality curves cross, and at all older ages, we discover a gradually widening gap of higher death rates in the Swedish population. This pattern, observed 10 years earlier by Thornton and Nam for Black and white Americans, might suggest the same sort of explanation Nam proposed then, a selection effect. Higher death rates at early ages eliminate more of the frail, vulnerable people, leaving a hardier group of survivors in that population who therefore show lower death rates in old age. In this 1978 article, though, the trouble was that the crossover did not show up only in accordance with this expected pattern. Nam and his students found 111 comparisons which showed a similar mortality crossover, but with the economic levels of the populations reversed. For example, comparing Canada to Norway rather than to Sweden also shows an old age mortality crossover. And again, death rates were lower in Norway than in Canada, up to about age 70, but then crossed over to higher Norwegian death rates at older ages. The trouble was that Norway's GNP per capita was lower than that of Canada rather than higher than Canada, as in the case of Sweden. Here we can't explain more intensive selective pressure of mortality in Canada than in Norway in terms of economic disadvantage, at least not as measured by GNP per capita.
Well, it was a mysterious outcome. However, some high income countries were apparently subject to causes of death that were not well controlled.
In fact, sometimes for mortality comparisons with no appearance of an old age crossover, we still find situations where the country with lower per capita GNP also enjoys lower death rates at all considered ages, as in the case of 1964 data for Norway again, this time compared to Austria. Despite its higher GNP figures, Austria also had higher death rates at every age.
It seemed that our measure of socioeconomic level for the populations was not the most desirable.
Apparently, simply ranking countries by gross national product per capita did not provide a consistent indicator that might point to more intense selective pressure of mortality in one country than another. In the half century since this article appeared in the journal Social Biology, other researchers have proposed that beyond simple GNP figures, we might need to consider how GNP is distributed within the population, that is, the level of inequality among people within a given country. There also could be effects on the age pattern of survival from factors such as availability and affordability of health care at working ages and in old age, or national policies concerning intergenerational transfers of resources, like old age pensions, or even differences of diet, or drinking, or smoking, or other lifestyle factors. The most innovative feature of this article, however, went beyond just considering where crossovers might happen and whether they might not point to greater or lesser selective pressure of mortality. The data from the Preston, Keyfitz, and Schoen volume also included information about the contribution of different causes of death to mortality rates in each country. Nam, Weatherby, and Ockay discovered that when a country's advantage of lower death rates at younger ages disappeared at a crossover to higher old age mortality, the culprit usually involved deaths from heart attacks, strokes, and other cardiovascular diseases. For example, the Swedish and Norwegian death rates that rose higher in old age than mortality observed in Canada tended to concentrate in higher levels of cardiovascular related deaths in old age. Since old age mortality is dominated overwhelmingly by these cardiovascular causes, it actually is not surprising to find that cause category explaining most of the crossover effect. Even when the crossover worked in the wrong direction, that is, the lower income population had lower mortality at younger ages, crossing over to higher mortality in old age, in most of those cases, it turned out to be higher rates of cardiovascular deaths in that country that accounted for most of the higher old age mortality overall. To quote from the conclusion of this article, no other set of causes of death seems to be of any substantial significance in affecting crossovers.
Well, where a crossover effect was observed, cardiovascular diseases and the category of other and unknown causes clearly accounted for the crossover effect.
But the findings of this article still move us forward in efforts to understand mortality crossovers because they rule out explanations that might point to other causes, such as various forms of cancer, digestive diseases that affect organs like the kidneys, liver, pancreas, and so on, and causes such as homicide, suicide, or accidents. The cardiovascular signature appearing in old age mortality crossovers, as established by Nam, Weatherby, and Ockay, shows that whatever features of social and economic organization are affecting the shape of the survival curve over the life course, they must be factors that play out in the timing and intensity of cardiovascular deaths in particular.